Good morning. It's Thursday, November 12th, and you are with us with The Doctor is In, Ask Dr. Arwady. I'm Sybil Madison, your Deputy Mayor for Education and Human Services. I'm here with Dr. Allison Arwady.
Good morning.
Your Commissioner for the Chicago Department of Public Health. This is where you can get the latest on COVID-19 in Chicago and get all your questions answered. You can put those questions in the chat box below. You can also send them to us using the hashtag AskDrArwady through Facebook or Twitter. We're going to check our distance and make sure
Looks
that,
good.
that we're good to go there. And I'm just going to turn it over to you to give us the latest.
All right. So the news continues to be bad. There's no other way to put it. If people have been following this, the U.S. is breaking records for cases, but also hospitalizations. Illinois is breaking records for cases and hospitalizations. And here in Chicago, we are breaking records every day for cases. We're not yet breaking our record for hospitalizations from the spring, but the way that we are increasing, we're going to get there relatively soon. And we will be talking at 12:45 today. There's a press conference with the mayor where we're going to be talking in some more detail, so you can tune in for that. But in the meantime, let's take a look at what our numbers look like. So as always, you go to chicago.gov/COVID- and you can get right to our daily numbers. And what you see when we pull this up, first of all, that positivity rate, it is up to 14.1% across the city. And if you go to the weekly by zip tab, what you'll see is that in parts of the city that have historically had very good control, a lot of the north side has often had lower rates overall, lower positivities. We're seeing positivities in that setting 8, 9, 10% even. And then some of the areas where we have historically seen the most cases and the highest positivity, those have just continued to grow as well. So down on the southwest side, we've got some areas that are 25, even 26% positivity, similar on the northwest side. All parts of the city are growing in ways that are absolutely not sustainable in terms of outbreak response and very, very high risk for COVID at this point. If we look at our testing numbers, we are breaking records there. We're up to almost 15,000 tests a day in Chicago, 14,807, the highest we've been, but not enough, where we've got a positivity of 14.1%. And if we look at our cases, we're up to a cumulative, we've had about 122,000 people diagnosed with COVID, but a large number of those have just been in the last few weeks. 17% of our cases are active right now. The cases that we've ever had in Chicago, almost 20% of them are sick and infectious right now because of how quickly this is growing. And you see that our daily cases are at 1,920 per day, almost 2,000 per day. That's up 36% just from a week ago. We were still in the 400 something range a month ago. And the fact that this is more than 4 times to up to 5 times where we've gone just over the last month, this is what we're talking about when we talk about sort of exponential and uncontrolled growth. Right here on this page, if you look on the upper right, this is our current growth. And you see how much higher our peak is now than it was in the spring. And it is true, in the spring we were testing much less. But the rate of increase has not slowed. The slope of that line is the thing that I am by far the most concerned about, because our doubling days here is still at 12 days. So what that means, we're sitting here at almost 2,000 cases today. 12 days from now, by Thanksgiving, we literally could have 4,000 cases a day coming in. Wow. And let me tell you, we are not set up to handle 4,000 cases per day. We're not set up to handle that from a case investigation and contact tracing standpoint. We're not set up to handle that, honestly, from a testing standpoint. We're growing very quickly in all of these areas, but the risk is huge as these numbers continue to climb. And unfortunately, as the numbers continue to climb, the response capacity has the potential to really get outstripped. And we're really feeling that here at the health department already, just as we're trying to keep up with these kinds of caseloads and working with many partners to continue to build testing capacity. So I'm very concerned. You can see our deaths here are up to 8 per day on average. For months and months, they were 2 to 3 per day. And the fact that those are up by 3 times is very concerning. Our hospitalizations, non-ICU, are up 3 times over the last month. Non-ICU, ICU, and ventilators, and deaths. And those have nothing to do with us testing more people. Those unfortunately have to do with hundreds and hundreds and hundreds of people right now in Chicago ill and hospitalized with COVID. So I am very concerned about the way this is going. And as you know, Chicago is sitting in the middle. We're the biggest city in the middle of the Midwest, which is what is driving this current surge of the outbreak. And there remain places that are doing even worse than us.
Right.
And that was the context in which we did update that travel order earlier in the week. But it is not a time for traveling. It is not a time for non-essential activities, honestly.
Yeah.
So.
Not a time for gathering.
Not a time for gathering, for sure. Yeah, and maybe we've talked about we've talked about some of those numbers, but we're continuing to add case investigations as we're able to keep up with them, and we do continue to hear a lot of the time still, about 2/3 of the time, people have a pretty good guess where they got COVID. It's somebody they know, and that does continue. That interaction often is still in the home. So if I had one choice, one thing that I could snap my fingers and change,
what would it be?
No gathering in homes. Nobody in your home that doesn't live there, unless it is absolutely essential. I'm talking like home health care worker, absolutely necessary childcare or education. And if anybody is in your home, meaning even those essential people, masks,
Distance.
Trying to distance, just being really serious about it. I think that would be my number one. I had a call yesterday with a number of the other big cities commissioners, and everybody is dealing with surges like this. Perhaps not with the numbers, quite what we're seeing here yet, but the rate of increase across the country has been similar. And we all feel strongly that sort of gatherings, basically, in homes, out of homes, just people coming together is our biggest risk factor, and it's one of the hardest things for us to control or mandate, because these are the choices that people are making in their individual lives. I also think maybe if I got a second in terms of snapping my fingers, making sure that people stay home when they're sick. Our very first order that we passed here in Chicago, even before the stay-at-home order last spring, was a requirement that you stay home if you're sick. And by sick, we haven't had to change the way we define that months and months ago in March.
And I think it's really important to list those symptoms, because it's more than just a cough.
Yeah. What are some of them? Do you remember?
If you have congestion.
Yep.
If you have a sore throat.
Yep.
If you are newly fatigued.
Yep. Muscle aches, exactly. Yes. Basically, if you're not feeling well, right? You're like, I just am not feeling well. You need to stay home. Because you know what we've seen in our case investigation data? I had the team go back and look at this. And remember, we're reaching out and we're working to interview people. We don't reach everybody. Lots of people don't pick up the phone, or there's delays coming in. But we do look for patterns locally in what we see. And of the people who were working, about half of them, their last date at work was later than their date of symptom onset, meaning they were at work while they were having symptoms. And I know people are, it's human nature to say, I'm not feeling so well. Let me see.
Pre-COVID times.
Pre-COVID times,
you would just come on in and
you'd say,
deal with it.
I'm not feeling terrible. I can power through. And even now, we have people, I think, who are saying, oh, I'm not feeling that great, but let me see, right? Let me see. And then maybe like 2 to 3 days later, they're like, okay, I'm still not feeling that great. Let me go get a test. The problem is you're spreading the most COVID in the 2 days before your symptoms start, and then really in those 2 days right after your symptoms start. You continue to potentially spread COVID for 10 days, which is why we have that 10-day isolation factor. But getting people to really be serious that, if I'm not feeling well, I better not be leaving my home except to seek medical care or testing, and I better be wearing a mask and social distancing in that context. But also then even within the home, I'm putting on my mask. Other people are putting on masks. We're sort of getting this COVID test.
Even before you might have
Even
go get the
before
test.
you might go get the test. We do not want people with this amount of COVID around.
Yeah.
We're just breaking records really every day, not in the way that we want to. And so I think not having people in your home and just assuming that you have COVID at all times. And which means wear your mask at all times, social distance at all times. And then especially if you have symptoms, you absolutely need, for the sake of everybody, to be limiting your exposures.
All right. I think that the people of Chicago could grant you your 2 wishes, actually.
Well, they are that's the thing, right? They actually are in.
I think we could do that for you, Dr. Arwady.
Oh, yes. These are my Thanksgiving
wishes.
wishes.
That's what it's coming down to, right? That's what it's coming down to.
Right.
Okay, well, this is kind of related to the data you just shared from Cam from Facebook. Where is this current uptick in cases coming from? I know you said it's like all over the Midwest. It's all over the city.
Yeah. So
why the uptick and why now?
Yep. So I think there's a couple things. One is that for really probably a month, we were watching with big concern surging cases around us. Wisconsin has been breaking records for months now. Yeah. Indiana was surging, downstate Illinois really breaking records in new ways. And for a while there, we actually were able to continue to hold relative success.
And we felt really good about it.
We were feeling pretty good about it. But as COVID starts to get in, right, despite the travel order, despite the relatively good job that folks are doing with masking and social distancing, it's just looking for opportunities to spread. And I know from being out on the streets in Chicago that we're not as serious as we were in the spring. We're just not. I see many more people not always having their masks, kind of getting together. I was driving around and I saw just group after group after group after group when we were having that nice weather these last few days. Yes. Couldn't look around without seeing a group of people. I know those people don't all live in households, and they were having picnics, meaning their masks were off, meaning they were interacting. And I'm watching this and just block after block after block saying, that's where COVID's spreading, and that's what you can see outside, where that's being replicated in people's homes. And the problem is we're seeing this surge in all age groups, right? We've seen this 4 times increase, not just in the 18 to 29-year-olds, in the people over 80, and the people over 70, and the people over 60, and the kids. That's not so much those older folks going out. That's the problem, that where younger people are out, they're then interacting with people who are higher risk. And so, I wish I could still point to one spot in the city and say, if we could really get this section under control, we'd be in good shape. Or if we could really just get the 18 to 29-year-olds, if we get that down, we'd be in good shape. We're far beyond this. This is a generalized community outbreak at this point. And that means that there is no area in Chicago that is not at high risk from COVID at this point, unfortunately.
Okay. This is from Jean Brooks from Facebook. We have family members who are positive, but some members of the family still testing negative. Can you review again who and when quarantine and applies, to whom and when quarantine applies and when can it be terminated? Okay.
So if by family members you mean people living in the same household with someone who has been diagnosed with COVID, everybody in that household needs to complete the 14 days of quarantine from whenever their last exposure to the person was. So if you're all still living at home, the whole household needs to complete quarantine for 14 days, regardless of who's had a positive test, who's had a negative test. Remember, we know that you don't test positive right away after contracting COVID. That's one of the things that's hardest about this. It takes a number of days. On average, we think of about 5 to 9 days after exposure of when people tend to turn positive. But we've seen people turn positive as much as 14 days. That's why that time period is in there. So regardless, you know, it is not a given that everybody in a household will get COVID for sure, particularly if someone is sick at home and everybody's doing a good job with masking and hand washing, and ideally the person who's sick is sleeping in a different room, even more ideally using a different bathroom, being careful about sharing utensils. It is not a given that everybody's going to get COVID, but being extra careful about it is important, and regardless of a negative test, everybody needs to complete the quarantine period.
Okay. And I think it's so important. There are people who are in situations where they are living with someone who has tested positive for COVID. And then being able to navigate that in the house, for some can be easy, and for others it's pretty complicated.
That's right. And there's information on the website about that, and some of, you know, really thinking as a family, making a plan for what you are going to do if somebody in your family gets COVID, because unfortunately, chances are high with the numbers here in Chicago that someone in your family, at least in your extended family, is likely to get COVID, even if that has not already happened, assuming that people are out and about in the world, unless you're being just so careful. And I hope more people will be even more careful and not sort of taking chances. But just with this amount of COVID, the risk is high. And so making a plan about what that's going to look like. Where is this person going to sleep? What are we going to do in terms of trying to keep them safe within the home? Where might we have kids go to stay? You know, where am I going to get tested? Who's my doctor? Who do I call? Like making a real plan.
And the issue with the kids, you might have somebody who has an underlying condition or an elderly person who maybe should leave the house or go someplace else.
Yeah,
right?
Potentially, right. And it's going to be different for all different families, and I can't tell you sort of for your family what works, but I do want people thinking now and making a plan now about what they would do if someone in their home got COVID. Make sure you're clear on how long somebody needs to isolate, what that quarantine period looks like. Know now who is your doctor. Does your doctor have testing available? Like doing some of this planning now, I think it's helpful so that you don't feel so panicky if it happens. It also, I think, helps people recognize that this is here and this is something we need to be being serious about sort of right now. Obviously, paired with that is doing anything you can to decrease that risk. Just don't have people over into your home, even for Thanksgiving. I know it's hard. Thanksgiving on FaceTime on Zoom does not feel right to us, but the risks are very real right now. And especially if we're talking folks with underlying conditions or who are older. I personally, even though I am being as careful as I possibly can be myself, I am still out. I keep my distance. You know, I wear my mask, I wash my hands. I'm not really doing anything at this point besides work, but nevertheless, I don't feel comfortable seeing my family if they're older, for example, especially. And there's good news about the vaccine, but the vaccine is not now. And so these next few months, unfortunately, are just on us and are on our ability to decrease risk and change behavior.
And getting back to the basics.
Getting back to the basics, yep.
Okay. You mentioned how we are not an island in the Midwest.
We are not.
Suzanne L. Hoffman has an interesting question. Traveling to Wisconsin for shopping.
Please no.
Less than 6 hours. No quarantine, right?
Please no. Please no. Do not travel to Wisconsin, especially for shopping. It is not necessary. Wisconsin, as bad as we are doing, Wisconsin is even doing worse. And if you travel to Wisconsin, there is a requirement to quarantine if you return to Chicago. I know there are reasons people may need to go, but those are reasons like I have someone in hospice,
Yes.
I have a like real reasons that may absolutely require travel, and you can travel, but then in that setting, unless you're under one of those exemption categories, you would need to quarantine upon return to Chicago. And I'm sorry, but we have to protect what we can here, and travel is a known risk. So please, no traveling to Wisconsin for shopping right now.
Shopping is not essential.
Shopping is not essential. There's nothing that Wisconsin has that's essential that you can't get here.
Okay.
Not forever, but for right now.
Right now, yeah. Brenda Storch from Facebook. Are people who are actively smoking, vaping, posing a higher infection risk on others? If so, why aren't there restrictions on smoking and vaping?
Okay, good question. So smoking and vaping do not increase infection risk. And let's talk a little bit about that. Certainly if I'm smoking or vaping, I'm maybe not doing a good favor to my own lungs in terms of if I were to get COVID and, we would like people to be as healthy as they can be and their lungs to be as healthy as they can be. So it would be better if I got COVID for me not to be a smoker. But in terms of spreading a risk, I think, yes, it is true that if somebody is smoking, they are exhaling, but they like the idea is you want to you keep that distance. You also can't have your mask on when you're smoking or vaping. Yes. So if you see somebody smoking or vaping, that is a person to stay a long way away from, I guess, is the way that I would put this. The smoking and the vaping itself don't add to the risk. And so we had an interesting question. I remember a month or two ago, someone was like, should I be concerned if I can smell somebody's cigarette smoke?
Oh, yeah,
and I think, there's this interesting idea where if you're imagining sort of moving through the world, this idea that if people were smoking, would you smell their cigarette smoke, lets you know you're too close to somebody in a lot of ways, right? Mm-hmm. And so there's nothing about the cigarette smoke or the vaping itself that increases the risk for COVID, but it is an activity that people do without a mask and they're exhaling. And so where people are smoking or vaping, they need to be doing that by themselves, ideally out of doors, and ideally a long way from others. So, good question.
Got it. Joanna Hernandez Duque from Facebook. Any recommendations if someone has COVID-19? What is the best medicine or remedies to use?
Oh yeah, good question. So there's been a lot of conversation, as you know, about different remedies, different treatments. And just as there's a lot of work happening for vaccines, there is equally a lot of work happening around the world on treatments. But to be honest, we've not made as much progress on treatments for COVID as we have on vaccine. And at this point, there is still actually only one drug that is fully FDA approved for COVID, and that's remdesivir. That came back from August, and that has been shown when people are sick with COVID to decrease, how long they may be sick with in the ICU, et cetera. It's not been shown to protect people from getting COVID, and it's really more for people who are more seriously ill. But there have been good trials that have shown, yes, this one definitely works. There are a couple of other types of treatments that have emergency use authorization from the FDA. And so that means they don't have the full authorization yet, but there have been, for example, at least one good randomized control trial, which is when some of the people get placebo and some of the people get the drug, and you follow them forward. So for example, dexamethasone, that's a steroid. That's a very old medicine. We use it all the time in the hospital. It decreases inflammation. That's one that has been shown to have some good effect. There are still studies going on about it, but generally if people are sick and in the hospital, they're getting it in that context. Again, not I take this at home because I think it's going to protect me. This is for when people are sick. And then
none of this is over the counter.
None of this is over the counter. And then the antibody treatments, I think, are some of both the convalescent plasma where people have recovered, and then the antibody treatments. And these are kind of two sides of the same coin in some way. Just as a reminder, the convalescent plasma, this is people who have recovered from COVID. Their bodies have made the antibodies, which is sort of the immune fighting material in your body. There's this idea that you can take plasma from someone who's recovered and then passively give the other person who's sick right now with COVID the antibodies to help their immune system better fight COVID. There's some mixed stuff on this. There's definitely been promise. There are still lots of ongoing studies where people are seriously ill. They're definitely getting this, and
we're doing one of those studies here, right?
Yeah, people are getting enrolled in these studies definitely here in Chicago. But that's an example of one that is still sort of being studied. And then the other are what are called the monoclonal antibodies, where instead of taking the out of somebody's body who's recovered from COVID in the laboratory, you work to sort of create or grow these antibodies. And so these are very expensive, and you have to get them through IV. It's the same thing. It's not a pill. But these are sort of in that like promising category where there's been the emergency use authorization in some cases, and some of the bigger trials are still ongoing. And so that, for example, is like what President Trump had, right? Like he got the remdesivir, which is the only...
He got the whole shebang.
He did. He got remdesivir, which is the only one that's FDA approved. He got the steroids, and both of those suggest he was pretty sick, because you would give those to people who are pretty sick. And then he got one of the newer antibody treatments called Regeneron. And these antibody treatments are increasingly available and out there. We actually are expecting to start to be getting some in Chicago here very soon. But I want people to understand these are still under trials too. And so
we still have a lot to learn.
We still have a lot to learn, and those trials are ongoing. I think for regular folks, and I don't know if she's interested if people are sick, not sick. That's sort of when you're in the hospital. There also are things just in the hospital, things like proning, where if somebody's seriously ill, we actually sort of flip people onto their stomachs and think about there's been different things about how we use oxygen and ventilation in different ways. We've gotten a lot better at taking care of people who are seriously ill with COVID in the hospital. But of course, we'd rather not have people get seriously ill at all. So one of these antibody treatments are also being studied as more of a, like, can we keep people from getting seriously ill if they're sort of just getting infected? And that's an area of some promise. There also are trials going on about some things like vitamins. And I know we get a lot of questions about that. Vitamin C has some anti-inflammatory properties. Vitamin D is something that sort of is generally good for the immune system. But again, we don't have any actual trials that have proven for COVID these are particularly effective. I think certainly, if you've had a vitamin D test and your doctor has said you are low, take your vitamin D supplements as you would. I think you can take the vitamin C. But what I don't want people doing is saying, I'm going to load up. I'm going to eat a whole bottle of vitamin D every day, because you can also have levels of these that can get too high. So I think people are often wanting to kind of take something, and I think a multivitamin is good. A regular dose of the vitamin D, especially here in Chicago, fine, but none of these, there is no cure for COVID. I think that's important for people to hear. And we are still very limited in treatments. For flu, that's not the case, right? We have Tamiflu, for example, that if you've just been infected with flu, you can take a medicine that's been shown to significantly decrease your risk for getting hospitalized or serious flu. We'd love to have something like that for COVID, but we just don't yet. And so, again, we're back to what we call non-pharmaceutical interventions. That's actually sort of the public health term for it. The things that we do that help keep us from getting COVID are still the number one thing that we have to prevent. But I think generally thinking about you being as healthy as you can at this time is good. Having any of your chronic conditions in as good control as they can be. Make sure, if you have diabetes, make sure you've got your medications, you're trying to eat well, you're keeping your A1C down. If you've got asthma, please make sure there's inhalers you take every day, that you've got those, that you're doing that. You have your rescue inhalers inhaler if you need it. If you've got heart disease, you're taking your meds, you're doing like whatever your underlying conditions are, now is the time for them to be in as good control as they possibly can be. You also should get a flu shot, because what we really don't want is flu and COVID in one person or in Chicago sort of together on top of each other.
Can I ask,
yes,
if you have an underlying condition and
yes,
maybe you haven't been taking care of yourself that well,
yeah,
should you go see your doctor?
yes, we do recommend people, yes, we're at a point where, you know, we've learned a very lot about how to keep settings relatively safe from COVID. We've learned a lot about how to keep hospitals, doctor's office, dentist's office, schools, workplaces generally safe from COVID. And so at this point, we think that the risk of sort of delaying care, especially necessary care, does outweigh sort of that COVID risk. Have a conversation with your doctor, because of course I can't speak for everybody. It depends on, you know, we've got everybody from people who are like in active treatment for cancer and have immune therapy. You know, there has to be some individual level here, conversation. But broadly speaking, yes, like you should. I want to make sure your underlying conditions, especially now, are as well as they can be. And then things like trying to make sure you're getting enough sleep, trying to make sure, you know, you're getting your heart rate up every day, just gentle walk, you know, by yourself is the best, right? No opportunity for spreading COVID there. And trying to do, it's a stressful time for people too. So whether, you know, meditation or prayer, talking to a friend, you know, calling some of the hotlines that we've got around your own mental health, all of these things help us be as healthy as we can be. And that's especially important right now. You know, right now. So, and then quitting, I mean, somebody asked about smoking. Like, it's a great time to think about cutting back or ideally quitting smoking. 1-800-QUIT-NOW will get you to the Illinois hotline and people who can help you do that if you're interested.
Yeah, and if you don't have a doctor, there are lots of places across the city where one can get care.
Yes,
right?
exactly.
Even if they're not insured.
Yes,
or,
yeah, all of our federally qualified health centers, there's information on the Chicago Department of Public Health site about this. Take people regardless of income, insurance, immigration status, and we really want to make sure people are plugged into providers. It's more important now than ever.
All right. Alana Levy from Facebook, if a friend or family member has been in the hospital for a non-COVID reason, should they isolate before they come around people in the house that have not been going out?
So I think this is someone who is in the hospital for non-COVID. What should they do?
Non-COVID, but now they're coming home. Should they isolate?
Yeah, I think, you know, again, the infection control practices in hospitals are very good at this point. So I don't have a major concern that someone who's been in the hospital for non-COVID would have picked up COVID. I think it's a time to be extra careful though. So you know, for the general person who's sort of in the home, I don't think there's a need to necessarily change there. But if you've got somebody who's particularly high risk, you know, maybe for some time after that, you're just especially careful. So we don't consider that sort of a high risk. And again, we don't want people avoiding hospital care where they need it. I don't want people having chest pain and thinking, oh, it's more dangerous for me to go get this checked out because of a risk of COVID. But I think just general careful is good. No requirement certainly for isolation after someone's come home from the hospital. But if you've got someone at home who maybe is in that highest risk category, at least for some time, you know, a little bit of separation there is probably a good idea.
Yeah. And I do think in many hospitals there's testing that's happening of the patients.
Yes, there's lots of testing that's happening. Yeah, absolutely. Like the hospitals, you know, they are the slightest concern, lots of COVID testing happening. Yeah.
Okay. Audrey Fisher from Facebook. Some people think that once a person has had COVID-19, they don't need to wear a mask. Please clarify.
So you do need to wear a mask. And thank you for that question. Couple things about this. Number one, we are still very much learning about what it means to have had COVID. Number one, we're learning that there are plenty of people who have what seem to be sort of some long-term effects that we're still learning about,
We've
et cetera.
heard people who don't have their smell back yet. Right?
and there's
Things
a
like
lot of that. But that's equally true on this sort of immunity side. And we do think, the CDC thinks, that probably for about 3 months after an infection, you have some level of protection probably against COVID. But it is absolutely possible, although we don't think it happens often, for you to be reinfected with COVID. We have seen that happen. And I'll be honest with you, I've been really surprised that some of the parts of the city that we've just been seeing high positivity in for weeks and weeks and months and months and months and months and months. I was talking about this with some of the folks from the other cities yesterday. We've all been surprised that there are not little parts of our cities that have been the hardest hit, that at this point you might expect to see some of that herd immunity, where we're talking about 25%, 30% positivity for months, where you're talking about places, I know I was talking to New York a little bit, and they've had, they've been the hardest hit, and they've got some of their neighborhoods. They did these serology studies where, went and actually looked, and very, very high percentages of these areas had recovered from COVID, had antibodies. And those same areas are like leading their surge again. And so we are still learning about this. I just want to be clear.
Yeah.
And we are not necessarily seeing the robust protection that you would expect to extend to your community once you've gotten enough people infected with COVID, just that we would have expected to see by now.
Interesting point.
Yeah, and so I think vaccine, is going to be a more robust way of getting immunity. But the other thing is, like, nobody knows that you've had COVID seeing you on the street, seeing you out and about. We need everybody doing this, because wearing this mask also signals, I care about you, you care about me.
It's symbolic.
It's symbolic. We want anxiety down. We want acceptance up. So please, even if you've had COVID, even if you're in those first 3 months, wear that mask, and just don't take risks with it right now.
That suggests that people who've recovered would still be suggested to get vaccinated.
Yes, absolutely. Yeah, great, precisely. And this has been really clear. We're not going to assume prior infection has given you immunity. There's too many questions about it and how long does it last. So yes, even people who have had COVID naturally absolutely are going to be recommended for vaccination.
Okay.
All right.
We are at the end of our time, Dr.
We are.
Harwoody. What do you have for us?
All right. So 12:45, come back for a press conference if you're interested. Our updated travel order does go into effect tomorrow. Chicago.gov/coronavirus if you've got some more questions. And just sort of from a positive community standpoint, Invest Southwest, as folks know, is working to really build up a number of the commercial corridors on the south and west sides of Chicago. And part of that is bringing public art. There's an artist in residence program. And so there's a pilot project bringing public art to Auburn, Gresham, Austin, Englewood, back of the yards. I really like seeing sort of signs of positivity and hope and growth and art out and about. So go see those by yourself. But still, it's good investment.
Yeah.
So.
All right. So in the meantime, think twice and be safe. Chicago will be back later on today and then Tuesday.
Yes. Thanks, everybody. Bye-bye.